So hello friends, welcome to the today's sessions. Today the topic is dangers of long-term insulin therapy in type 2 diabetes. Okay. Nowadays the problem is so many people in type 2 diabetes without following properly the lifestyle modifications. Okay. They are initially taking one medicine, then two medicines, then three medicines, and gradually their medicines number increasing, rise, and finally they put on insulin therapy. Okay, so if we give this long term insulin to particularly type 2 diabetes, so what may be the problems arise in the future and how we can reverse the diabetes, all these things we can discuss in this issue. So आज का इस वीडियो में बिकॉज बहुत सारा डायबिटीज़ पेशेंट लोगों के लिए ही ये वीडियो है जो इंसुलिन ले रहे हैं, ठीक है। तो प्लीज़ वॉच दिस वीडियो बिकॉज इसमें बहुत सारा चीज़ मैं ऐसा डिस्कस किया हूँ, बहुत सारा स्टडीज भी इसमें से है, जो एकर ट्रायल है, यूकेपीडीएस ट्रायल है, उसका क्या क्या नतीजा है, उसका रिजल्ट्स क्या है, उसको कैसे हम यूटिलाइज कर पाएंगे लाइफ टू लाइफ एंड कैसे उसको रिवर्स करना बहुत ज़रूरी है। बिकॉज अगर हम इंसुलिन का टॉक्सिसिटी नहीं समझेंगे, इंसुलिन ज़्यादा लेने से क्या दिक्कत हो सकता है उसको अगर नहीं समझेंगे तो हम इंसुलिन नहीं छोड़ पाएंगे, उसको रिवर्स नहीं कर पाएंगे, ठीक है। तो इसलिए आज का टॉपिक सबसे इम्पोर्टेंट इसलिए है बिकॉज सो मैनी पीपल्स in this topic I particularly highlighting one point. I am telling about this long term, right? Long term insulin injections. I am not taking any short term. Suppose you are doing any surgery or anything, you require insulin, then you have to take it. But if you take long term insulin, okay, so what may be the effect? And particularly for type 2 diabetes, right? In type 2 diabetes, as you all know, this is a insulin resistance disease, जिसमें इंसुलिन का अवरोध होता है, ठीक है। तो इसमें अगर ज़्यादा इंसुलिन लेंगे तो प्रॉब्लम कैसे बढ़ता है उसको हम सब डिस्कस करेंगे, राइट। एंड कुछ स्टडीज़ के बारे में भी हम आपको बताएंगे, उसके हिसाब से हम लोग वी ग्रेजुअली डिस्कस वन बाय वन टॉपिक, राइट। सो टुडेज आउटलाइन, आज का जो टॉपिक का कोर्सेज है उसमें इंसुलिन टाइप 1 डायबिटीज़ जो है कैसे इंपॉर्टेंट है, बहुत वेरी गुड है, उसको भी डिस्कस करेंगे। लेकिन उसमें भी अगर ज़्यादा दिन लेंगे कैसे डबल डायबिटीज, व्हाट इज डबल डायबिटीज, उसको भी डिस्कस करेंगे। व्हेयर लॉन्ग टर्म इंसुलिन नॉट द आंसर फॉर टाइप 2 डायबिटीज, उसको डिस्कस करेंगे। प्रॉब्लम्स विथ लॉन्ग टर्म इंसुलिन ट्रीटमेंट इन टाइप 2 डायबिटीज, उसको भी डिस्कस करेंगे, ठीक है। एंड देन इंसुलिन टॉक्सिसिटी एंड कैंसर, अगर इंसुलिन ज़्यादा दिन लेते रहेंगे तो क्यों कैंसर होने का चांसेस ज़्यादा बढ़ जाता है, ओके। इंसुलिन रेजिस्टेंस ऑल्सो ए कॉज ऑफ कैंसर, उसको भी हम डिस्कस करेंगे। एंड हाउ टू रिवर्स डायबिटीज़ विदाउट इंसुलिन बाय वेरी सिंपल मेथड, उसको भी हम लोग डिस्कस करेंगे, ठीक है। सो इसमें जो पहले चर्चा कर लेंगे कि इंसुलिन जो है जो टाइप 1 डायबिटीज़ के लिए वरदान सबूत होता है, ठीक है। बट बिकॉज उनका बॉडी में ना इंसुलिन प्रोडक्शन नहीं होता है, ठीक है। तो इसलिए हम लोग बोलते हैं जो टाइप 1 वाला पेशेंट होता है ना, उनको इंसुलिन थेरेपी के लिए हम लोग रेकमेंड भी करते हैं। बट अगर वो लोग भी ज़्यादा दिन इंसुलिन लेते रहेंगे तो उनका भी जो प्रॉब्लम आता है मैं आपको दिखा देता हूँ। अगर टाइप 1 डायबिटीज़ पेशेंट अगर ज़्यादा दिन इंसुलिन लेंगे तो उसमें क्या होता है कि उनका जो वेट इंक्रीज होने लगता है, ठीक है। उनका वेट इंक्रीज होने लगता है, वेस्ट सर्कमफेरेंस, BMI, ये सब इंक्रीज होने लगता है, ठीक है। तो उसके बाद क्या होता है ना, अगर उसमें इंटेंसिव इंसुलिन ट्रीटमेंट अगर ज़्यादा दिन लेंगे, कुछ स्टडीज़ भी आया है अभी कि उसमें क्या होता है, उनका कोरोनरी आर्टरी कैल्सिफिकेशन, कैरोटिड मेडियल थिकनेस, कैरोटिड इंटिमल मेडियल थिकनेस ज़्यादा हो जाता है। देन देयर हाई इंसुलिन डोजेस रिलायबली प्रेडिक्टेड इन दिस मेजर्स ऑफ एडवांस्ड एथेरोस्क्लेरोसिस। सो उन लोगों का भी प्रॉब्लम बढ़ते जाता है। मैं एक देख चुका, मेरा एक फार्मासिस्ट था, मैं एक मेडिकल में जब काम कर रहा था, उसका टाइप 1 डायबिटीज था, वो इतना बहुत मोटे थे, ठीक है। मैं पूछा कितना दिन से आप ले रहे हैं डायबिटीज़, वो बोले कि नहीं मेरे को 12 साल से मेरा चल रहा है इंसुलिन, ठीक है। लेकिन अभी वो इतना मोटे थे ना, उनका अराउंड एज था अराउंड 40 या 45 एंड उसी 2 to 3 ईयर्स के बाद वो उसका डेथ हो गया। क्यों हो गया, उसको बोलते हैं डबल डायबिटीज़। इवन टाइप 1 डायबिटीज़ था, इंसुलिन ज़्यादा लेने की वजह से इंसुलिन रेजिस्टेंस हो जाता है बॉडी, ओबेसिटी ज़्यादा बढ़ता है एंड उसके बाद टाइप 2 डायबिटीज़ तरह ये करते हैं, शो ऑफ करते हैं, ठीक है। सो दैट इज कॉल्ड डबल डायबिटीज़ बिकॉज बोथ टाइप 1 इज एग्जिस्टिंग प्रीवियसली एंड नाउ टाइप 2 डेवलप बिकॉज ऑफ हाई डोजेस ऑफ इंसुलिन, ओके। सो हाई डोजेस ऑफ इंसुलिन इज द कॉज ऑफ दिस type 2 diabetes in this cases, or that is called double diabetes, right? So since this intensive glucose control using this insulin causes the weight gain, and metabolic syndrome is the hallmark of hyperinsulinemia in type 1 also, if they are taking long term insulin, right? And this hyperinsulinemia में जो आपको बोला कि इंसुलिन का लेवल यानी कि डोज बढ़ते जाता है, इन टाइप 1 डायबिटीज टू मच इंसुलिन कॉजेज द सेम exact problems found in type 2 diabetes, right? Exactly same problem. Okay, so this is the thing what happened, you know, if you see the graph, okay, in this graph this is the weight, okay, measure weight gain of the patients, and this is the follow up in years. If we see up to 9 years also their follow up, then their intensive insulin, their weight gradually goes off, and that's why if weight goes off, that leads to again insulin resistance, right? And type 1 diabetes, the too much insulin, that means in that type 1 also that leads to hyperinsulinemia, and these patients essentially developed so called double diabetes. Okay, what actually I want to try to explain you. So insulin in type 1 diabetes also, if we take long term without measuring the blood glucose and all these things, okay, without changing the lifestyle, that's also a problem. Please remember this thing, right? So again in type 2 में हम लोग देखेंगे उसका कितना डेंजरस रहता है उसमें, ठीक है? तो ये तो ग्राफ हो गया आपको इंटेंसिव ट्रीटमेंट कितना. यस, हुआ है लॉन्ग टर्म इंसुलिन नॉट द आंसर फॉर टाइप 2 डायबिटीज. ओके, टाइप 2 डायबिटीज में हम लोग देख लेंगे थोड़ा, ठीक है? तो अभी जो यूकेपीडीएस ट्रायल आया था ना 2000 मतलब जो 1970 से चल रहा था, लेकिन उसका जो नतीजा आया ना उस स्टडी में ना, यूकेपीडीएस दैट इज यूनाइटेड किंगडम प्रोस्पेक्टिव डायबिटीज स्टडी, ओके, एक ट्रायल है, बहुत अच्छा ट्रायल. दिस स्टडी रैंडमली असाइंड अराउंड ऑलमोस्ट 4000 पार्टिसिपेंट, 4000 न्यूली डेवलप्ड पार्टिसिपेंट, ओके, न्यूली डायग्नोज्ड टाइप 2 डायबिटीज पेशेंट, ओके. एंड इन दैट ट्रायल व्हाट नतीजा क्या आया कि हम लोग ये सोच रहे थे कि अगर ज़्यादा मेडिसिन देंगे, ज़्यादा इंसुलिन देंगे तो उनका जो कंट्रोल आएगा HbA1C बहुत अच्छा आएगा, वो बहुत अच्छे से रहेंगे, ठीक है? लेकिन द रिजल्ट्स वर स्टनिंग बिकॉज द स्टनिंग बैड रिजल्ट, दैट इज इंटेंसिव जो ग्रुप थे उसमें जो ज़्यादा इंसुलिन, ज़्यादा मेडिसिन चल रहा था, ऑलमोस्ट नो मेजरेबल बेनिफिट्स आया उनका. मतलब जो हम लोग सोच रहे थे उसी ट्रायल के दौरान कि उन लोगों का बहुत सारा बेनिफिट मिलेगा, वही भी नहीं मिला. एंड हाँ, यस, उनका ब्लड ग्लूकोज लो लेवल में आया, लेकिन उसके बदले उनका वेट गेन ज़्यादा हो गया. इंसुलिन ग्रुप गेंड एवरेज ऑफ 4 किलो ज़्यादा वेट उनका आ गया, ठीक है? तो इसलिए हम लोग बोलते हैं, एंड उनका जो हाइपोग्लाइसेमिक जो सिम्टम्स है वो भी ज़्यादा था उसमें, राइट? सो हाँ, what are the results of this echo trial? Again we see another trial, okay? So what are the result in this trial also? In this trial also we see, action to control cardiac risk diabetes trial. मैं क्यों आपको ये सब ट्रायल दिखा रहा हूँ? मैं इसलिए दिखा रहा हूँ कि उनका आपका प्रूफ आएगा. प्रूफ मतलब आप कैसे बोल सकते हैं ये सब विदाउट एनी प्रूफ. सो आई जस्ट वांट टू सी यू दिस प्रूफ्स, ओके? यू कैन ऑल्सो type in Google and you can also see all these things, right? So let me tell the more advanced form that the results of this echo trial. In this trial was designed to test whether the taking more than 10,000 type 2 patient, okay, and in this trial उसका क्यों किया गया था, उसका एम्स एंड ऑब्जेक्टिव ये था कि जो whether taking medications for intensive blood glucose control would reduce the risk of heart attack, stroke, death from cardiovascular disease and other cardiovascular. मतलब अगर जो मेडिसिन हम लोग दे रहे हैं वो अगर ज़्यादा दिन लेंगे तो उसका कुछ अच्छा इफेक्ट्स है क्या? मतलब ज़्यादा दिन अगर लेंगे तो वन ग्रुप ऑफ पेशेंट रिसीव द स्टैंडर्ड ट्रीटमेंट. स्टैंडर्ड ट्रीटमेंट मतलब लाइफस्टाइल एजुकेशन एलोंग विथ कुछ दवाइयाँ, बट इंटेंसिव एंड अनदर ग्रुप वाज टेकिंग intensive treatment, like they are taking only medications and high dose of insulin also to control blood sugar, like absolutely normal in that group. Oh, okay. So in that group, the other group received the high doses of medications along with insulin to control their blood glucose. Okay. So in this study हम लोग क्या देखेंगे, इन दिस स्टडी में रिजल्ट क्या आया था, नतीजा क्या आया था, वही हम लोग देखेंगे. कि हम लोग जो सोच रहे थे उसका अपोजिट, हम लोग सोच रहे थे कि हाँ मेडिकेशन बहुत अच्छा है, वो लोग अगर ज़्यादा दिन लेंगे तो बहुत अच्छा से बचेंगे, लेकिन उनका जो स्टडी आया था ना उसमें ओके जस्ट ए मिनट, हाँ उनका जो स्टडी आया था उसमें द फर्स्ट रिजल्ट फ्रॉम द एक्कर्ट trial study published in 2008 that proved that the intensive medical therapy could reduce the A1C grade, but did this make any difference to the health? That means even if their HbA1c comes to low or normal, then is there any effect on long term, that means long term mortality or cardiovascular events or heart attack? No. In this study also, that in the patient those who are intensively treated, the death rate 22 times higher in that cases. Okay, so this is also not good for those who are taking only medications and insulin for this treatment. Another two trials are there. Okay, that is the veterans VADT trials, the veterans affairs diabetes trial, that found that intensive medical therapy produced no significant benefit of heart, kidney and eye disease. Okay, and the outcome reduction with an initial glargine intervention. ओरिजिन ट्रायल उसमें भी सेम रिजल्ट आया था कि ट्रीटेड प्री डायबिटीज विद एन अर्ली इनिशिएशन ऑफ इंसुलिन, हम लोग सोच रहे थे कि उनका बहुत अच्छा रिजल्ट आएगा, लेकिन देयर वाज नो रिडक्शन इन द हार्ट डिजीज, स्ट्रोक, आई डिजीज, पेरिफेरल वास्कुलर डिजीज एंड ऑल दिस थिंग, राइट. And the classic medications for type 2 diabetes including insulin, metformin and sulfonylurea, all this failed, right, in long term. Okay, the OHO so-called golden medicines like glimepiride, glyburide, what you are taking, that produce more insulin, but is that effective for long term to reducing the mortality? No. Okay, उसको आपको समझना है. And yes, so in type 1 diabetes blood insulin is low because there is no production of insulin, इसलिए हम लोग सी पेप्टाइड का टेस्ट करवाते हैं. ठीक है, तो in that case if it is low, if your insulin is not producing from your body, then you are taking from outside, it is well and good. Okay, it is logical, right? But in type 2 diabetes patient, the insulin is high, so giving more insulin is the problematic. You must have to remember this thing. Okay, giving more insulin to this particularly type 2 diabetes patient is problematic. After of giving more alcohol to, as I explained with some example to all of you, why? Because giving more alcohol to a alcoholic patient is good or bad? Obviously bad. Okay, and using heating blankets on a heat stroke victim, is it the not winning strategy? Okay, that again increases the chances of stroke. And treating the sunburn by getting more sun is not the winning strategy, right? Like that, this giving more insulin to somebody who are already suffering from insulin resistance or much more insulin or hyperinsulinemia is not the winning strategy. We are not winning, we are going to fail. Okay, so if you are taking insulin for type 2 diabetes, you are under the so many risk factors like heart disease, kidney disease and your eye disease and all so many complications. Okay, so logically the effectively treating type 2 diabetes requires an approach to lower both glucose level and insulin level. That is called, we must need to reduce the insulin toxicity and glucotoxicity. Two toxicity are there in that cases. Okay, so we must need to minimize this two toxicity, not only one toxicity. Okay, so people only see the glucocentric model. That model is actually not working for long term. Okay, for short term well and good, but the main cause is insulin resistance, right? We must need to work on that. So for that we need a proper lifestyle, the food which are lowering the insulin. Okay, just I am giving one example. In case of diabetes and in case of infection, just I am comparing these two things. Okay, suppose in diabetes the cause is and treatment, suppose I am giving for example of a malaria fever infection, there is malaria, right? Or suppose typhoid, I am taking typhoid example. The bacteria is the cause, Salmonella typhi is the cause, antibiotic we give, that is the proper treatment. Then the symptoms if we come, the fever is the symptoms, and this acetaminophen or paracetamol what we are giving, this is for the only to control the symptoms, it's not for long term use, right? But similarly we compare with the diabetes. Okay, the symptoms is your high blood sugar, it is not the cause. Okay, and symptomatic treatment what you are taking now, OHA, that is glimepiride and all these medicines and insulin, these are all only symptomatic treatment. So what happened if we take only paracetamol and reduce the fever without taking the proper treatment? Then your insulin, your infection become gradually spread up inside your body and you go to sepsis. Okay, so the main thing is that we must need to understand this thing and we must need to root out this cause. The cause, what is this cause in this case, particularly type 2 diabetes? We must need to understand the cause of this type 2 insulin resistance, hyperinsulinemia, and the treatment should how to reduce the insulin resistance, right, by a proper lifestyle modification. We will discuss this with this soon. So just I want to explain you ki we must compare these two things and we must work on this thing. Okay, otherwise we will suffer a lot and early dies also with this thing. Okay, so that means so many people, you also heard that it is very hard to treat this type 2 diabetes with multiple pathophysiologic abnormalities. So many abnormalities they are there. Okay, like some people tell ki decrease production of insulin secretion, some are tell ki hyperinsulinemia, decrease incretin effect, increase lipolysis, increase glucose absorption, so many things so many people will tell in type 2 diabetes, right? So you must remember these are all the causes of hyperglycemia. So where hyperglycemia occur? Because insulin is not, even if you have sufficient amount of insulin in your body, the insulin cannot work properly, right? And that's why you need to increase the insulin sensitivity, not to take extra insulin from the outside, what is going on now. Okay, so that's why I try to understand. Suppose it's a normal cell, right? It's a normal cell, and in this case what happened, there is no insulin resistance. So when insulin come, okay, there the receptors are there, then it will jump on the receptor. Okay, it will work and glucose will enter to the cell. Okay, but what happened in case of insulin resistance or in case of type 2 diabetes? Even if you have sufficient amount of insulin and the glucose also, so insulin, this you can see, this is the receptor is damaged. Okay, receptor is damaged in case of particularly type 2 diabetes. Okay, this is the receptor, this got damaged, insulin receptor. Why it got damaged? Because of high insulin resistance, abnormal fats inside the body, that fats accumulate in this over this receptor and make it junk. Okay, so we must need to remove out this junk, we must need to repair this receptor. Okay, okay, so receptor cannot work like lock and key. If the key cannot work, the lock cannot open the room and we cannot enter the room. Exactly like that, insulin cannot work on this receptor and glucose cannot enter to the cell. That's why we feel weakness. Okay, so you need glucose from the outside, and you need, even if you eat so many food, your glucose will be high in the blood, cannot go inside the cell. Okay, so insulin resistance leads to high level of insulin, remember it. Okay, so that's why you must need to understand that temporarily insulin will work, but it cannot work for long term. Okay, if you give long term, then there is so many side effects are there. Okay, then also what is the cause of this resistance to antibiotics? As you all know, okay, so many infections now, era of antibiotic resistance. Okay, if we give one antibiotic, then after some days that antibiotic will resistant, that antibiotic cannot work. If we give same antibiotic repeat continuously, because the bacteria is very mutating. Okay, they mutate to survive. Okay, so even if give same thing again, okay, then this antibiotic cannot work. Just like in viruses cases also, right? They mutate because they have to also survive, right? So this is not work for permanently. And what causes this resistance to addictive drugs? Okay, so many drugs like nicotine, alcohol, and benzodiazepine, all this cocaine, because when their level is gradually increasing, okay, and they gradually resistance, and initially if you are taking alcohol, if you are taking 2 pack, that cannot work for you. You must have to take 3 pack or 4 pack or 5 pack like that. Okay, so that small amount cannot work for you. That's why I told that is called resistance actually. Okay, so if we take multiple times, if we take more frequent time of this tolerance, because that drug cannot work in your body, so you must need to take higher dose for that. Okay, so again it's like a just down regulation of receptors, because your receptors gradually resistant to that drug and it cannot work. Okay, like small baby, they are very matlab resistant to these things, and they are in ADHD also. Okay, main thing what I actually reinforcing cycles of resistance, because what causes this insulin resistance? Does insulin cause insulin resistance? This is the $1,000,000 question nowadays. Okay, what insulin we are giving from the outside, really that insulin causes insulin resistance, or is there any other causes of this thing? Okay, so that's that thing we must need to discuss in this thing. What is that causes of resistance? Okay, so let me take one example. Insulinoma, there is a pancreatic tumor, you just try to remember, and उसमें क्या होता है, अगर पैनक्रेटिक ट्यूमर को हम लोग अगर रहने देंगे तो उसमें ज़्यादा इंसुलिनोमा मतलब ज़्यादा इंसुलिन प्रोडक्शन होगा. जितना ज़्यादा इंसुलिन प्रोडक्शन होगा आपका, ग्रेजुअली बॉडी क्या करेगा, इंसुलिन रेजिस्टेंट करेगा. बिकॉज ज़्यादा इंसुलिन प्रोडक्शन होगा तो ज़्यादा ग्लूकोज आपका सेल के अंदर जाएगा. ज़्यादा ग्लूकोज जाएगा तो उसमें ग्लूकोज ज़्यादा हो जाने की वजह से उसमें फैट में कन्वर्ट हो जाता है. ठीक है, तो उसको हम लोग बोलते हैं कि योर मतलब fatty acids, or that fats inside the cells, adipose tissue, that excess amount of fat again causes resistance to this insulin. So this is survival, this is actually survival mechanism. Okay, you must need to understand. Surgical resection of this adenoma reverse the insulin resistance. In case of insulinoma, if we surgically resect that thing, so we will reverse the disease, right? So like that, just example I am giving to you. Okay, like that, what problems occur in insulin causes insulin resistance. That's why we told if we take more amount of insulin, type 2 diabetes, that leads to again insulin resistance, right? So this is the graph. Also, so many studies now prove that ki production of insulin resistance by hyperinsulinemia in men. Okay, this is published in Diabetologica journal also. So if we take simple more amount of insulin also, that leads to hyperinsulinemia. Okay, insulin causes insulin resistance. Remember this thing. Okay, so if you see also diabetic patient, particularly type 2 diabetic patient, they are taking initially low dose of insulin. Okay, but gradually that dose of insulin cannot work in their body, and they need to take higher doses of insulin also, right? So where this is not working, initially they are taking 10 unit, then 20 unit, then 30 unit, and all these things. Okay, so even I have seen some patients, they are taking 100 units and 150 units like that. So because it cannot work in their body, right? So if we take more amount of this insulin, then this causes so many complications also. Okay, so insulin causes insulin resistance because it is already proved. Intensive therapy of these things also already proved in type 2 diabetes. So many journals now proved it. Then pulsatile release of this prevents the tolerance also. Okay, and this because insulin two types actually. One is baseline insulin secretion, another is your when you eat, that insulin will secrete. So if we eat frequently, frequent episode of eating is the one of the main cause of this insulin resistance, right? So we advise in our camp or in our program also to reduce the frequency of eating. Okay, it's a very good thing. Then the conclusion is because the insulin causes insulin resistance causes hyperinsulinemia, and resistance of this insulin, that's why it requires more amount of insulin from outside. So that insulin is the cause of this resistance and this hyperinsulinemia, right? So if more amount of insulin secreted by your ultra processed food, refined chawal, refined roti, and all these things you are taking from outside, आप अगर ज़्यादा refined वाला ले रहे हैं, refined your carbohydrate, your processed food, that is the main cause of insulin resistance. And if you are taking frequent meals, दिन में 2 बार 4 बार, दिन में 2 बार बहुत अच्छा है, लेकिन दिन में 10 बार 12 बार 11 बार लोग ले लें अभी. ठीक है, मॉर्निंग से एक बार, then breakfast, then your snacks, then your lunch, then post lunch session, and then again snacks, again. Okay, so many meals are there, up to 11 p.m. they are eating also. So that is one of the main causes of this. That means high glycemic index meal, or the meal which has glycemic index more than 55. Okay, so that is called high glycemic index, mostly of carbohydrate rich foods. So what are the complications developed in diabetes? Let us discuss this thing. Okay, in type 1 and type 2 diabetes, this high amount of blood sugars, okay, that creates problem. We all know, okay, that whenever this high amount of glucose deposited in our body, it may be deposited in the kidney, it may be deposited in the brain, it may be deposited any part it will deposit and damage. Okay, rather than this glucotoxicity, there is another toxicity you must need to remember, that is called your insulin toxicity also. Okay, because the main thing is that if we reduce the amount of sugar, if we reduce the amount of, then we can also reduce the complications also in type 2 diabetes, right? So accord trials, there is a trials action to control that trial also. In that trial also it is proved that there is intensive therapy group where hazard ratio is more. That means if we make super control of blood sugar with high doses of medication and insulin, then chances of death is more, right? So what should we do, okay, in case of hyperinsulinemia in type 2 diabetes particularly? Because if we take high doses of insulin outside, or if we are eating the food that causes high secretion of insulin inside our body, like ultra processed food, packed food, then this high amount of insulin causes enhances the VLDL secretion. Just a minute, I just want to explain you, okay? And this insulin, this high doses of insulin, that causes also atherosclerosis. That is one process where there is a some atheroma or plaques formation inside your artery, okay, and this enhances the VLDL synthesis in your liver and increases the cholesterol transport into the anterior smooth muscles, and the growth factor that enhances, actually the augments the collagen synthesis, stimulates the proliferation of arterial smooth muscle cell, and finally causes atherogenesis or atherosclerosis, right? So if we taking high insulin, then this is a chances that diabetes is the disease of insulin resistance, and current treatment is directed high blood sugar. This is the problem. We only focusing on blood sugar, we must need to focus on insulin resistance, okay, what actually we try to understand you, ठीक है? तो इसमें जो आता है हमारा इंसुलिन जो ट्रीटमेंट टॉक्सिसिटी, दैट इज कॉल्ड इंसुलिन टॉक्सिसिटी. दिस इज द पार्ट 1 ऑफ दैट वीडियो, एंड सो मेनी पेशेंट वी हैव सीन लो डोजेस, हाई डोजेस, एंड if we take super high doses of this insulin exposure, then chances of death and chances of toxicity, chances of death, all cause of death like cardiovascular death or all this is high in that cases, okay. Significant and graded association between the mortality risks and insulin exposure level. These are the study confirmed. मैं नहीं बोल रहा हूँ, स्टडीज बोल रहे हैं आपको, ठीक है. So you must need to understand कि अगर आप भी ज़्यादा इंसुलिन ले रहे हैं टाइप 2 डायबिटीज़ में, there is a chance ki early chances of death also, right? So insulin treatment has the toxicity because we see if we are giving the metformin versus sulfonylurea versus insulin, metformin में थोड़ा कम है, सल्फोनिलूरिया मतलब जो ड्रग इंसुलिन सिक्रेशन ज़्यादा बढ़ाता है हमारे बॉडी में, लाइक ग्लिमेप्राइड, ग्लिक्लाजेन, ऑल दिस थिंग, इट एक्ट्स लाइक इंसुलिन एंड देयर इज इंसुलिन. सो इफ वी सी द डेंजर्स, देन सबसे ज़्यादा डेंजर है इंसुलिन में, ठीक है. अगर ज़्यादा दिन आप तक इंसुलिन लेते रहेंगे तो आपको ब्लड प्रेशर हो जाएगा, आपका वेट गेन हो जाएगा, एंड आपका वजन बढ़ते बढ़ते जाएगा, आपका ऑल दिस प्रॉब्लम इंक्लूडिंग द कार्डियोवास्कुलर मोर्टालिटी ऑल्सो इंक्रीज, राइट. सो यू मस्ट नीड टू अंडरस्टैंड दिस थिंग. Then this is called hyperinsulinemia. If there is a high amount of insulin inside your body, what causes this atherosclerosis? We must need to understand these points, where if hyperinsulinemic body has this this is actually cross sectional view of a what, your artery, okay. This is the outer layer, okay, and this is the smooth muscle layer. There is you can see there is a proliferation of smooth muscle layer, right. It should be like very small, but when you see in this case, hyperinsulinemia case, the size of the smooth muscle layer is large, and also there is a atherosclerotic plaques here, okay. Fats are accumulated, thrombus formation occurs here, and disrupted endothelium. There is endothelial layer, right. This layer is disrupted, and inside the layer there is a accumulation of fats, and right, this is the problem, okay. So where these things occur, because this hyperinsulinemia or high insulin act as a growth hormone, right. It increases the adhesion of the molecule expression in the endothelial cells, increase the transendothelial migration of the leukocytes. आपका ब्लड्स के अंदर जो ल्यूकोसाइड्स है ना, उसको ज़्यादा बढ़ाता है, यहाँ एक्यूमुलेट करता है. स्टिमुलेशन ऑफ स्मूथ मसल सेल प्रोलिफरेशन, स्मूथ मसल लेयर जो है उसका प्रोलिफरेशन ज़्यादा बढ़ा देता है, इसीलिए आपका जो आर्टरी का साइज होता है ना वो छोटा हो जाता है, जो लुमेन होता है ना वो छोटा हो जाता है, ठीक है। दैट प्रो इन्फ्लामेटरी इफेक्ट्स, अगर आप लोग ज़्यादा टाइम इंसुलिन लेंगे दैट हैज़ ए प्रो इन्फ्लामेटरी इफेक्ट, राइट। सो यू मस्ट नीड टू ग्रेजुअली टेपर ऑफ योर इंसुलिन in if you are type 2 diabetes, okay. So you must need to think that, otherwise the problem happens is your, because any artery, you know, if that is a coronary artery then heart attack, or if it is in a brain artery then stroke, right. So you must need to understand this thing. And insulin receptors staining in human plaques also we are fine, so many, because of hyperinsulinemia this thing happening, right. So and insulin toxicity in diabetes, basic science evidence suggests that insulin itself is a toxic agent, okay. If we take higher doses then your blood glucose level will become low, and most common side effect is your hypoglycemia. So many patients we are seeing, because they are not dying with hyperglycemia but they are dying with hypoglycemia because of this side effect also, and so many other side effects are there, because low A1C is not good for you sometimes, where if you are taking more amount of insulin and lowering your HbA1c, it is already proved in by this echo trial also, okay. Then not the case of non-diabetic, because in case of diabetic we are telling all these things. Metformin versus sulfonyl, if we compare, then chances of the problems or your death more in sulfonylurea as compared to metformin, right, because of high insulin secretion causes, okay. And again same results, okay. So sulfonylurea versus metformin, if we compare, then the deaths, MI, myocardial infarctions, strokes, your all this problem is high in case of glipizide or sulfonylurea type group of drugs, like if you are taking glimepiride, you are taking gliclazide, all these things are sulfonylurea. So this medicine is more dangerous if you are taking long term as compared to metformin, okay. Some are good because the sulfonylurea group medicines causes more insulin secretion inside your body, that causes hyperinsulinemia and insulin resistance. You must need to remember this thing, okay. Then long acting insulin increases the risk, as we discussed the issue, where because so many people are taking long term insulin in the night, and that insulin actually causes so many atherosclerotic problem and all these things, right. So that's why if you are taking long term insulin, now be aware of all these things, right. And yes, also because insulin also causes cancer, okay. Diabetes increases the risk of cancer, and it is mostly due to insulin resistance, and mostly we have seen in the type 2 diabetes patient, it is the problem, right, where because of, you can see, hyperinsulinemia. Hyperinsulin increases the cancer risk, right, because insulin acts like a growth hormone. It increases the adhesion, it increases the growth of the smooth muscle, right. So this retrospective cohort study of 62,809 patients newly started on diabetes medications, and there is study occurring in that patient, the chances of this, if we see the sulfonylurea versus metformin plus sulfonylurea plus insulin based therapy, then if we compare the effectiveness, we also find something ki chances of insulin, the more amount of adjusted hazard risk, means the cancer risk is higher in the patient who are treated with insulin. This is the study, just I want to clear you, because in this study you must need to know the chances is more of death with cancer in insulin patient, right. Then common pathway of insulin sensitivity, obesity and cancer risks we must need to there is the genetic, if we go to PTEN gene mutation occur, and that leads to insulin effect and weight gain, decreased HbA1c, increased cancer risks, okay. This is the New England Journal of Medicine journal. So PTEN mutation as a cause of constitutive insulin sensitivity and obesity, right. So you must need to understand the high doses of insulin is not good for you, and it also gradually leads to overgrowth, obesity, weight gain and so many problems in the future, right. So again there is other drugs, but I don't want to discuss this rosiglitazone and insulin, all these things, but mainly today we focus on this, what is the current treatment paradigm going on with this insulin. Diabetes patient come, first we give glimepiride or metformin or drugs like that, sulfonylurea, then gradually this medicine doesn't work and we again advise for insulin. So really this insulin helps a lot. So what is going on actually in this current treatment, right? So gradually increasing the insulin resistance, their resistance is going on, their blood sugar initially low, but gradually that sugar level also increasing, right? So you cannot treat a hyperinsulinemic patient with high doses of insulin. As I told, we cannot treat a patient of alcoholic with high doses of alcohol. Just like that, we cannot treat a patient of hyperinsulinemic with high doses of insulin. That's a wrong actually, right? So the problem happens, what actually over time, what is the current paradigm going on now? Metformin, then one glimepiride or glyptide, gradually it cannot work, then gradually insulin, then more insulin, then finally so many complications like that, and your MI, heart attack, and so many strokes like that. So it is the epic fail. Diabetes get worse. Diabetes secretion, diabetes screening is useless sometimes. Where? Because we are doing the screening, but we are not teaching the patients, or we are not teaching with only how to take control over the insulin resistance, right? We are only teaching what you should do, only blood test, sugar test, and all these things. But we are not testing actually what should be tested. The first thing, insulin level should be tested to know the hyperinsulinemia. Okay. Treatment consideration. If we come to treatment consideration in that cases, first thing is insulin causes diabetes. All you know, insulin increases the cancer and severe risk factors. Insulin decreasing the insulin reduces the diabetes, the cardiovascular events, and your death. Okay. And how to decrease the insulin and without raising the blood sugar? This should be the treatment protocol. Okay. Insulin is the problem, not the solution. So you must need to remember. And low insulin diet protocol, or good is if you are taking metformin or Onglija or acarbose group of medicines, that is good. But bad is insulin, sulfonylurea, this TZD group of drugs. All these problem, if you take multiple times in Onija or gliptin group drugs or SGLT2 inhibitor, that is good medicines, okay, in this case, but not this insulin, sulfonylurea, TZD group of drugs. If you are taking long term, that causes problem, okay, because all these medicines that causes high insulin secretion inside your body, right? And this surgical, there is other options also, surgery, okay. So many patients now doing what is that, bariatric surgery, okay. In case of bariatric surgery of sleeve gastrectomy, there is around 3/4 of your stomach is removed, right? So that they make a removal of this part, okay. There is small part of stomach you have, and this was sleeve gastrectomy also. More than 90% cure rates occur in that case, because you cannot take much amount of food, right? Overeating should be prevented with this thing, okay. And there is a diabetes reversible disease. In case of, if we see actually changes in beta cell sensitivity and beta cell function, already proved by scientists nowadays, right? Because due to high hyperinsulinemia, there is a fat accumulation occur inside your liver, inside your pancreas. So pancreas cannot produce proper amount of insulin sometimes, or the fats particularly, okay. Different actually so many different our muscle cells are there, and all are resistant to insulin, okay. So if they cannot produce properly, and their fat inside their cells will gradually decrease, and beta cells functions, these are all reversible actually. Previously we told no, you cannot reverse diabetes, you must have to take diabetes medicine for lifetime, but nowadays there is no concept, because the concept has changed nowadays, and you must have to understand with these studies also, okay. Food rationally decreasing the diabetes, that means the food which is whole food, what we are advising to our participant in our group, that is very, very important to reduce your sugar level, okay. Surgery cures diabetes, already we see, that is called bariatric surgery. Sometimes I call it barbaric surgery, because I never advise my patient, because so many complications are there. Just if you control the mind, if you have some knowledge, then you can reverse it directly from the home, and where you need to take this surgery and so many operations and all these things, right? So fasting is a best method, simplest method, cost effective way you can do right from the home, okay. What we advise to my patients, versus bariatric surgery, we compare these things, right? This is weight loss and this is the daily glycemia, we can compare. This is the fasting results and this is the your surgery results. Okay, so the thing is that rapid improvement of diabetes after gastric bypass surgery, is it the diet or surgery which has more effect? Always remember. Okay, this is the diet and this is the diet plus surgery. Okay, and if we compare in this weight loss, more in diet. Okay, so diet is very important and we must need to along with fasting protocol, because when we do the fasting, alternate day fasting in non-obese patient, or sometimes different models of intermittent fastings are there, what we advise in our protocol initially. So gradually we start this protocol with reduction of some medications. Fasting improves the insulin sensitivity. Okay, so they are very much sensitive, and this is the graph where we can see if we do the fasting, then your doses of insulin decreases because your insulin resistance decreases and you become easily reverse your diabetes, right? Fasting increases the growth hormone. That is a very good thing, because sometimes we feel in fasting we feel weakness and there is all this thing. Okay, but nowadays so many studies confirm that fasting is very good for our health, and growth hormone also increases. It is a very good thing, right? Intermittent calorie restriction is better than continuous. Okay, that's why we advise intermittent fasting is better than continuous. Okay, in intermittent fasting, okay, that is what we advise to our patient also. And the clinical effects, if we see also, fasting reduces the diabetes. This study at what we have done, obese type 2 diabetes patient randomized to standard calorie restriction or 5-day period. So best is if we do this kind of short-term intermittent fasting, not continuous. Okay, so fasting associated with less DM and CAD, your diabetes level decreases, your coronary artery level decreases, and you feel very good. So it's the time to get started, my friend, because if you are taking insulin, if you are taking medications, then it's the time to stop that gradually with this protocol. And also whole food diet. All this is the episode 1 what we discuss in this video, and in this episode 2 also we discuss. You see one of my patient, I just showing the result, right? He was around weight 84 kilo and 69 kilo, and number of 3 tablets glimepiride, metformin, voglibus, but now no tablets. His HbA1c initially 8.8 but now 5.4 without any without any medicines also. So type 2 diabetes easily reversible, right? And you can see Mr. Rajnikant, who has 104 kilo when we joined my program, but now 92 kilo. His number of 22 medicines he was taking, now only 2 medicines, along with he was taking insulin around 100 unit of insulin, 65 unit of insulin, but now no any insulin. His HbA1c initially was 10.68, now it is 7.74, right? So that's a very good thing. Then this is Mr. Srinath Babu, who was initially taking 55 unit insulin, now nil, no insulin, weight 72 kg, now 61 kilos. So many proofs we have. Okay, so nowadays we can reverse the diabetes, right? We can reverse and become normal. So we have also, Mr. Rajkishore Das, who was initially taking 100 unit of insulin. Okay, after joining our program, gradually stop his insulin. 103 kilo, now 81 kilo, right? And his HbA1c from 10 to 5. So many success stories we have with this implementation of this program. Okay, so you can also join with this program. My WhatsApp number is not visible here. I think this is the problem, something is cutting. Okay, so you can write down my WhatsApp number. I just telling you, just WhatsApp me your reports or your problems, then I will help you. My WhatsApp number, please note down: 720-526-2973. Just let me write this thing. Okay, so you can also 720-526-2973. So this is my WhatsApp number. If you have any questions or regarding this reversal of diabetes, if you want to join our program, because we have one online course also. After consultation we will give the link of all these things to you. So this is the time of reversal, my friend, and it's the way to reverse your diabetes, not to take the medicines for lifelong. Okay, so you must need to know this fundamental thing what actually I am telling now, because nowadays so many people in diabetes doing wrong things, like without changing any lifestyle. They are taking first medicine, then second medicine, then third medicine, then fourth medicine, then insulin. They are obese and so many problems going on. Okay, so it's the time to gradually taper down your medicines, become insulin free and have a healthy life. So thank you so much, friend, watching this video. This is the episode 1. In the episode 2 we will discuss more studies and more about insulin toxicity and how it is dangerous, how diabetes medicines not working if you are taking it for long term. Everything we discuss one by one. So those who are watching this video, please forward to your friends and family members and stay connected with us. Thank you so much, friend. Thank you so much. Bye.